everybody. Well, if you're confused about Medicare and insurance, I want you to listen very carefully because we have the expert of experts to talk to you today. And this is Cynthia Meacham, and she is with an outstanding company, and it's called Senior Services North America. So what you want to do is get a pencil and paper if you can, make notes, because when we get finished, you'll want to call her and check with everything. If you are interested in who isn't in your Medicare insurance, this is the time for you to do it. So Cynthia, thank you so much and welcome.
Thank you for having me, Anita.
Cynthia, is there a deadline for something like this that people have to act quickly?
Well, it's usually open enrollment if they would like to switch their plans. But if they did get into a plan during open enrollment that they're not happy with, they have to the end of this month to make one change with their Medicare Advantage plans. Yes.
Okay, that's great. So let me just tell you that Cynthia holds a very high position with the company. She is actually, she's the local independent agent for Senior Services of North America. That's a fabulous company. And you're all over the country, aren't you?
We are. We are all over, from Florida to California to New York. We have agents everywhere.
But South Florida is the best.
It is. It's nice and warm. Everyone else is freezing and we're nice and warm down here.
Well, we have a lot of sophisticated people too, so I think this should be a good thing for you. Let me start off by, why don't you share with us today what services you do provide in the area for our seniors?
Okay, well, I'm really an unbiased resource for the seniors, Anita. I represent all the top carriers for your Medicare Advantage and your Medicare supplement plans. So within those, everybody has different needs and different wants. So I'm able to, thoroughly find out exactly what that senior needs and put them in the appropriate plan, because Medicare supplements are great, but not everybody can afford them. And quite frankly, even if you can, sometimes you don't want to pay out. So there's lots of options out there that I'm able to give to everybody.
That's a very important point, because it's the options, I think, that people are interested in, because the names are all the same out there. They don't know this one or that one, but you hear, well, we give you this, we give you that. So what do you do when you're talking to someone? And do you put, I'm sure you don't, but you don't put the people in the same health plan. Why don't you?
No, unfortunately not, because there's just the shoe doesn't fit everybody. And depending on if you like to travel, if you don't, if you're local and you don't, go anywhere, or sometimes people have chronic conditions, other people, are Medicaid, Medicare. So with those people, I'm also able to find the right plan. And these plans are so rich out there for them that they're always very, very happy, and we can always help them if they're even, if they're getting extra help, we can call into the companies and make sure they're on the right plan for that. And, the different kinds of options for them.
You sound like you're a friend to them and not just some phone message service that people unfortunately have to get to. And I hate it myself. They need someone to talk to.
Right. So with me, you call me directly. Everybody has my direct number, and I actually am very thorough with the first thing that I always ask is your doctors, your hospitals, any clinics, and then your medications, because there's a lot of inaccurate information out there concerning these Medicare Advantage plans. So I can always usually find them their doctors. I never take anybody away from their doctors, because as you know, if you're, aging into 65, you've been going and seeing that primary care doctor or your cardiologist or what have you for a long time. So I never switch anybody off of plans, and I'm usually able to find them the right plan with the right carrier, whether that be Humana or Aetna, United Healthcare, or even on the MedSup side.
I'm so glad you know about this, because there are people who really do have to understand what a senior wants. Let me give you Cynthia's phone number now, because we'll be giving it all along. Get your pencils out. This is ZOOMERTIMES TV number 954-802-0738. Again, it's 954-802-0738, and that will go directly to Cynthia Meacham. We're the ZOOMERTIMES. We're actually The magazine is Boomer Times, and they have a wonderful ad in the March issue. So if you're listening and you want more information, go to page, let's see, it's on page 8 in the March issue. So Cynthia, you're very attractive and you're very articulate. And that's really important for a senior because there's a trust factor, and you know that.
Absolutely.
Sometimes they call someone and they don't like them and they don't even want to talk to them. So how do you get them to know who you are right off?
Well, I normally pre-COVID, I love to meet with my seniors. I love to sit down and, get personal with them. Otherwise, since we've had COVID, I can't really do that. So I'm not pushy at all. I take my time with them. If a lot of times they have their children that help them with their Medicare. So I always talk to the children and I make sure we're all on the same page and everybody understands exactly what they're getting. So that way we can do it, and it's all electronic. I can do everything online. I can send everything via email. We have a website. If people want to see me, I direct them to my website, which is Cynthia Meacham Insurance, and there's a picture of me and there's even a video of me on there. So then they get to know me, and the more that we talk and they see that I'm really here to help them, that usually they can tell that I'm not here just to sell them something, because I represent everybody. So whatever you're looking for, I'm really able to find the right shoe for you.
Okay, and so how do you do that? How do you find the right and suitable plan for them?
The first thing and the most important is your doctors. I find out who their doctors are, who's most important to them. And then, like I said, their hospitals or their clinics, and then their medications, because all the formularies are different for each of these plans. So I find out everything that they have, and then I see who has the most affordable, comprehensive, suitable plan for the senior. And then I present that to them and let them make the decision.
And you actually have a list of all this? I mean, you're talking about a lot of people here. So you have a list of doctors and all this?
Yes, I actually have a very cool website, and I can put in everybody's information right in there, and it'll actually pop up and generate what company is going to cover them the most comprehensive. So it's very cool.
I see. Yeah, it sounds like it, because it's a big issue you're dealing with. So
yes.
Okay, so do you probably find a couple that fit their requirement? So, and what makes the difference? How do they decide?
Well, I take it if they travel, if they're going to travel and they're going to, a lot of times seniors travel either here to New York, I find a lot, or sometimes they have children throughout the US. So I then take it a step further and see what plan. I would go for a PPO and see what plan is going to cover them in that area they're traveling in. And then we take it from there. And then we even go either further, because a lot of these plans, Anita, are doing dental, vision, and hearing. Some people need transportation. So I find out exactly what their needs are, and then we kind of break it down so that we're able to compare apples to apples, and then they can make the best decision for them.
So Cynthia, I heard that HMO is Advantage plans. If you go to New York for something, you can't use that. Is that true?
That is correct, unless it's in the case of an emergency. If it's in a case of an emergency, you are covered in an emergency. But if you do have an HMO and you're traveling and you want to go see a doctor, you're going to have to pay out of pocket for that, because an HMO really only covers you for that county. Where a PPO, yes, in PPO, you're going to be able to travel, and you have in-network benefits and even out-of-network benefits. So even if your doctor isn't in that plan, you're still going to get coverage to see them.
So you're talking about a supplemental plan also, right? So tell us what the difference is between the two.
Okay, so the easiest way to kind of break it down is with the Medicare supplement, you can go anywhere, any doctor, there is no network. You pay a premium for that every single month, and you also have to get Part D. So you're paying for that whether you use it or not. With the Medicare Advantage, you're paying as you go. So there's usually a zero premium with that plan, and there's small co-pays for if you do go in the hospital or if you do go to the doctor. There's small co-pays. So a lot of people that are even coming off group insurance are fine with small co-pays, because that's what they've had pretty much their whole life. So they'd rather pay zero, pay a little bit as they go. And even if they're traveling, they can still get a PPO plan, which is your Medicare Advantage, and they're able to see doctors nationwide.
Right. And how about prescriptions?
Prescription drugs are covered with most of all the Advantage plans. You do not have to pay separate like you do your Medicare supplements. So all the formularies are different though per the plan. That's why I take everybody's medications down, and then I find out what plan's going to cover them at the least cost, out of pocket for the client.
Probably when you're talking with someone, you could spend an hour on the phone with them at least, couldn't you?
I easily spend an hour. Yes, I do. Because you know what? The more time I'm getting to know you and I'm getting to know exactly what your wants are, I'm going to find you the perfect plan where you're going to, be happy with it, and you'll be, have everything that you need per se.
Okay, and the most important question here is, so now you've signed them up. Can they always get in touch with you if they have questions?
Always. My clients, she was calling me this morning at 9 o'clock. Yes. And I pick up from 8 a.m. to 8 p.m. And they love it. They know that they can call me for anything. Sometimes they'll even call me with their neighbor there because the neighbor has a question and they don't know who to call. So I encourage it all.
Yep, that's the problem.
A lot of times there's
no one to call. They join by a phone number or something or online, and so that's what makes your situation very, very good. I'm so glad that we have you as part of our family here. So the phone number to get Cynthia, yeah, right, it's really important. Cynthia Meacham, and you can call her at 954-802-0738. And she's a part of the Senior Services North America. It's wonderful that you people can call you anytime. Don't call her at 8 at night, but it's an emergency. I'm sure she's okay. But let's try to get that phone number down. Join with Cynthia and her organization when she finds something that you like. Now, what about people who have already joined something and they want to get out of it?
They're they're in there for right now. If they haven't made a change during AEP, which is your October 15th through December 7th, then you're in the plan. Unless you move, then you're in a special election period, or if you get extra help, that also puts you in a special election period. So there's a few times where I can change them. Otherwise, you're in for the year.
That's good, because my father is no longer alive, but he was easy prey for people. And every time I go to see him, he went to a different, I'm talking about probably 25 years ago. He went to a different HMO. And I was like, who's HMO now? And they love to get seniors and confuse them.
They do. Well, what they do now is there's something called the scope of appointment. And it's to protect the seniors. And before I can even present anything to you guys, I have to have you sign the scope. And that says I'm only going to go over Medicare Advantage plans today. And that way, you know you're not going to get a bunch of other info kind of pulled in there and they're signing up for something that they didn't even know they were sitting down for. So that way it helps out with that, because 10 years ago, yeah, we were calling and it was very easily to get, the application, and people were confused. So the government has stepped in and really tried to protect that from happening again, protect you guys.
Well, Cynthia, as you said, you spend a lot of time with them, probably much more than an hour. So how much do you charge?
Nothing, absolutely nothing. All my services are complimentary, and I'm paid by the insurance company. So you guys are not out of pocket anything, and you're just going to have a good resource for somebody to say, hey, am I in the right plan? Because I called up Humana and this is what Humana gave me, but they're just selling you that one plan. And that's the great thing about us, is we represent all of them. So I can, find the company and the plan that they're looking for and that they need.
Yeah, that is so good, Cynthia. I have to tell you, it's joyful to hear about this, because I hear a lot of, talk about seniors. Oh, I got this, I don't like it, and I don't know who to talk to, but now I have someone that they can call you. Even if they're not Absolutely. On your plan, they can still call you and you'll help them. Absolutely.
My pleasure.
Okay, so we're going to go over something else with you. So if someone if they don't want to call you on the phone, how else would they get in touch with you?
They can go to my website, and then you can hit contact me, and that'll give email as well. I have a short Cynthia the Insurance Lady @gmail. They can always email me that way, and then I can answer that way as well.
Cynthia the Insurance Lady, huh?
Yes.
That's a great email. I love that.
You can't forget it, right, Anita?
No, it's lovely, and you are very attractive and very articulate. How long have you been doing this?
Since 2006, 15 years
Ah,
this year. Yes, 15
started out
years.
right out of high school.
I love it.
What made you get
Almost.
into this? You sound like you
Well,
could be a talk show host, actually.
you know, my mom always wanted me to be a weather girl, but here I am doing
I
insurance.
bet you could be a better.
I used to have a pet sitting business, and a friend of mine got into insurance. And after listening to them helping people and getting them on the right plan, I said, "Oh, I think that would be something for me as well." So I went ahead and got my insurance license and got rid of all my dogs that I was taking care of, and kind of transitioned over. And I've never looked back because it has been fabulous. I truly love what I do.
Do you still have a dog?
I have a dog, but not the dog sitting business anymore.
No,
But
I know,
yes,
but you have a dog because you love
I
dogs.
do. I love dogs and cats and fish and hamsters and got a whole house.
I'm sure there are people who you talk to who also love these things, and that makes you a friend of theirs, right?
Absolutely. Absolutely.
So let's go over this a minute. How many companies? I don't know if you know exactly, but I mean, you say something about Humana because they advertise a lot on TV, but are there 10 different companies out there that people can choose from?
Oh, there's a ton of different companies out there that people can choose from. And I represent all of the top A-rated companies that aren't going anywhere. You'll hear about these small companies here and there. And I tend to stay away from those because I like the company that that's going to be there, to support you if you need anything, and that has a big network of doctors. Because I mean, there's even cancer centers now that are accepting Medicare Advantage plans.
Really?
So
Oh, that's
yes,
new,
yeah.
isn't it? That's new.
Yeah, there's Miami Cancer Institute, there's Memorial Cancer Center now, there's Cleveland Clinic, and they all accept these different kinds of plans. So,
Well, I think that's appropriate. I think they should. I'm glad that that's happened.
absolutely.
Okay, so let's say someone gets, unfortunately, they get cancer or something very serious. Now, there's always questions because they get bills. Would they call you? Are you the person that they call now rather than, maybe their lawyer or their accountant? Are you the one that understands the bills?
Well, the bills, they probably have to call claims into the insurance company, but everything is very black and white in the summary of benefits when we go over it. So if they call me and they say, "Oh my gosh, Cynthia, I just went and got this done and the copay is very high," and I'm looking, we will call together and I'll try to figure it out with them together. But I always have them call me first, just to make sure I can't figure it out for them. And if not, then we'll call three-way, sometimes even into the company with me on the phone, so we can get down to the bottom of it.
Cynthia, I hope you really know what a wonderful thing you do. I mean, as a gerontologist, I hear so many problems from older adults, and they're always calling me to help them. And I always say you have to find somebody with that company. And sometimes the phone rings and rings and rings, they can't get through.
I know, it's so frustrating. So I try to make it simple, and I try to take that frustration away from them, and try to be the main source. And if I can help, I will. And if not, then I'll have them call directly in and find out what's going on.
I'll bet you get a lot of referrals.
I do get a lot of referrals.
I'm sure you do.
And I love it. I mean, that's the best thing you can do for me, is give me a referral, because now I know that you're taken care of and I can take care of your friend or your relative or whatnot. Yes.
No, well, it's because you do seem to know so much, and you have such a splendid personality. I think it's really important. So let me tell you again, my wonderful guest is Cynthia Meacham, and her phone number. Remember, write this down. Don't put it on a little sticky yellow ticket because you're going to lose it. Write it somewhere and put it up in your refrigerator or somewhere. Even put it in the refrigerator. Okay, the phone number is 954-802-0738. Again, that's 954-802-0738. And that's Cynthia Meacham. And she is with a very major company, it's Senior Services North America. And she has this title she is actually the local independent agent for Senior Services of North America. Tell us a little bit about that company, would you?
Well, Joe, you've spoken to him, and you can tell how great he is. So he has really built this company up, and it's a whole family operated business. So if I can't, get him, there's always his wife I can call and help with anything. He has his son working there, and he just has an office that is so supportive. And it's beyond just even helping you guys with your Medicare. There's final expense and help with wills, and of course annuities. And it's a whole range. So we have the support with, Senior Services in North America to be able to help the seniors with whatever they need beyond
Yeah,
Medicare.
I'm so glad I had a call from him, because I had not heard of his company before. And now I'm very happy to know there is a company like this, and that you're so big and a part of it. So do you have people who are very old? What's the oldest client that you have, do you think?
93.
Oh, that's not so old.
No, 93. She's my oldest, but we just have a friend whose grandma just turned 107. So I always tell her,
Really?
a couple years ago. Yes.
And is she healthy in a way? I mean, can she speak, or she have any
yes.
sickness?
I think there's a little sickness starting to come along, but no, she can talk and walk, and she's fabulous. Yes.
That's what's happening. And I think it's because of the healthcare. Years ago, there was not healthcare like this. And maybe and I know for sure that's because they go to their HMO, or they go to their insurance company, and there's certain procedures that they have to do, just like now with COVID. I don't know how the HMOs are doing it, but are they handling the COVID with their clients?
A lot of the times the testing and the treatment for COVID is covered at 100%. So they're very good. But Anita, a lot of the times I'm meeting with seniors, and everyone's so active. Everyone wants to make sure that they get this gym membership because they want to go and walk around or do weights or whatnot, or join a class. And one of the companies even give out that Fitbit watch for them, so they're able to track their steps, and they play with their friends and see who can get more steps in that day. And the seniors are really, really active, more now than I've ever seen before in the past 10 years. And the more that they're going, they're just not stopping.
You're going to see a lot of people older than 107 in the next 10 years, I'm sure.
I love that. Yes.
Right. Well, I wrote a book called Live to Be 100 Plus in 1992, because I believed that was going to happen. Right. But it's interesting now that you say this, because I think that healthcare is the secret. And a lot of people, because they didn't have the money, or even now they don't have the money, they haven't joined something, and they just sit and rot at home.
I know, that's so unfortunate. And like I was saying, a lot of the times with the Medicaid, Medicare clients, they are able to actually choose a plan that gives them so much. Oops. Yeah, there you are. Yeah. So it's great for them. And they even give them healthy food cards, believe it or not, so they can go and spend.
Tell me about that. No, tell us about that.
Yes, one of the companies that I represent, they give a $50 per month food card for healthy foods. So they're able to go to the market and get, as long as they're getting healthy foods, they're able to go ahead and use that.
Not cigarettes, you mean healthy foods?
No, yep, apples, oranges, fruits, vegetables, all the good stuff that's keeping us, 100 plus.
Now that's smart. I think I hadn't heard about that. That's excellent. I know about the gyms, the silver sneakers, something like that. That they have all sorts of things, but they also, something too, that people have denied themselves going to a dentist because they didn't have the money, and that wasn't part of insurance.
I know it's bad. And now they're so rich. There's even a few companies out there that will pay for a crown, an implant. So they're able to go, instead of having their teeth rot because they can't get anywhere, they are really able to go now and get that service that they need, covered by the insurance companies.
Right. So there goes false teeth.
Yep.
That's, you brought so much good news to this interview. I have to tell you that as much as I think I know a lot about it, there are many things you told me that I don't know. And I'm really glad that you're doing this interview. And we're going to put this interview out online, and people who haven't heard it, we'll have to encourage them to listen, because Your information is very valuable, Cynthia. I don't know if you're really aware of how little of this goes on out there.
That's what I want to do. That's perfect. That's what I want to do. I want to get all the information out there and let you guys make the right decision, but you need to know what your options are all the way across the board. So that's what I pride myself on, is being with all these companies, and that way I'm able to make sure that you're in the right one.
And you've been doing this for a long time. You said it's like, what, 12 years?
15 years.
15 years, my goodness. And so you have seen a lot of changes, and you have absorbed so much.
Yes. And I love it. There is nothing, more that there's nothing else that I would rather do.
It's obvious, Cynthia. It comes across that way. So are you our weather lady from now on?
I might be. I can be every morning. We can come on and we can, tell the weather. And
right. Every time we have you on, every time we have you on the show, we're going to have to first start with a weather report.
Too funny.
What's the weather like now, Cynthia?
Well, it's beautiful right now. It's like 80 degrees. There's no clouds. There's no humidity. Right. It's almost spring.
Right. We'll have to have you on before a hurricane.
Oh, yeah, right. Outside with my hair blowing.
Yeah, right. We'll have to have you put that up. Well, now, the one other thing I was curious, is there a place for them to meet? Like there is like senior centers or something that some of them have?
That's correct. Yeah, one of the companies, Humana, they actually have centers throughout Broward County, West Palm, Dade, and they can actually go there. They have little seminars throughout the day about their health plans. They can, grab a cup of coffee, use a computer, whatever they need, and then they get to go somewhere if they are having a problem, and they can talk to somebody and they can help them through it. So they really like these, because nobody wants to call on the phone and sit there forever. So if I'm not your agent and you can't call me, at least you can go now, and you can go somewhere and, have somebody talk you through it and walk you through it.
Right. I think that's really the way that it should have been. And I'm glad they've caught up. I guess there's so much competition now. Everybody has to think of what they can do that the other one's not doing to be able to get them as a client.
That's right. That's exactly right. And that's good for us, because in that way, everyone's kind of, throwing out all the best benefits. So
absolutely.
That's a good thing.
Yes, it is. And I'm glad for our seniors that they have that opportunity. So again, let me just do this again. Cynthia Meacham, M-E-A-C-H, let's see, A-M, right? M-E-A-C-H-A-M, Cynthia.
That's correct.
Local independent agent for senior services of North America, and you can call her. Let's see, I have your phone number. I guess that's the number for you. It's your cell phone. 954-802-0738. And are you the only one for senior for this company down here? So are they going to get someone else, or are they always going to get you?
No, that's my direct line. There are a few agents down here, of course, that we all work together, but that's my direct line. So whenever they need anything, they can just call me directly.
Yeah, they're going to want you. And I know they don't say, I don't want you. I want that lady that was on the interview. I know her.
They can call me. No problem. I'd love to hear from them.
Well, we've really run out of time anyway. We want to say goodbye to you. Look forward to our next time that we can talk to you.
Thank you so much, Anita.
Yeah, thank you so much for being a part of our interview. You're really terrific. Absolutely terrific.
I appreciate that. Love to meet you today, Anita. You have a great day.
Okay, bye.
Bye-bye.